Hey fam, welcome back to Octavious Wellness Center, where we keep it real, raw, and refreshingly relatable. Now let me ask you something that might sound a little strange. Have you ever felt like you've been tired for years? I mean, not just I stayed up too late on TikTok tired, but the kind of exhaustion that lives deep in your bones. Maybe you've got brain fog, joint pain, random mood swings, or digestive issues that make no sense. You've been to doctors, maybe even specialists, and they either shrug or give you that classic, "It's probably stress." But what if, hear me out, what if there's a connection no one's told you about? Hepatitis C, yep, that liver virus. Your doctor probably only mentions if you're getting screened for blood transfusions, tattoos, or drug use. But what if hepatitis C isn't just about the liver? What if it's secretly tied to a whole range of chronic illnesses? That's what we're unpacking today, with warmth, some laughs, because laughter is the best medicine, and a whole lot of facts that might just blow your mind. Let's go. What is hepatitis C really doing to the body? First off, quick recap. Hepatitis C is a virus that primarily affects the liver. But this isn't your run-of-the-mill flu virus. Nope. Hep C is sneaky. It's persistent. It can stick around for years, even decades, often with no obvious symptoms. And while the liver is the virus's main target, studies now show that hepatitis C infection can spark a range of systemic issues, affecting everything from mental health to immune function. And yes, even chronic fatigue and brain fog. Think of it like that one house guest who was supposed to stay for a weekend and is now reorganizing your entire kitchen. Some key facts to drop. Hep C infects an estimated 58 million people globally. Around 70% of those infected develop chronic infection. Many people don't even know they have it until the damage is done. And now science is starting to show that Hep C might play a role in triggering or worsening certain chronic illnesses. So yeah, maybe not so harmless after all. Chronic illness symptoms that might be Hep C related. Let's talk about symptoms. And I want you to mentally check off any that feel a little too familiar. Constant fatigue, muscle aches and joint pain, brain fog like walking through a mental swamp, mood swings or depression, insomnia, chronic inflammation, digestive issues, weak immune response. You get sick like all the time. Now imagine dealing with all that for years and not knowing why. That's the experience for many folks living with undiagnosed Hep C, or those who've developed chronic illness triggered by it. What's wild is how often these symptoms are misdiagnosed. People are told they have fibromyalgia, chronic fatigue syndrome, depression, or autoimmune disorders. And sometimes they do. But underlying it all, Hep C could be quietly fanning the flames. The overlap, hepatitis C and chronic fatigue, brain fog, pain. Let's zoom in. Chronic fatigue. One of the most reported symptoms among Hep C patients is deep, unrelenting fatigue. Not the kind that goes away after a nap. We're talking energy debt that builds day after day. Brain fog can't focus, keep forgetting stuff, mix up your words. That's not just stress. Neuroinflammation caused by Hep C can mess with cognitive clarity. Studies show Hep C patients have higher rates of cognitive impairment, even before liver damage shows up. Pain and inflammation. Joint and muscle pain could be linked to systemic inflammation. Hep C activates the immune system constantly, even when there's no visible threat. This constant low-level war inside your body can mimic or trigger conditions like arthritis, lupus, and even MS. So, yes, hepatitis C could be masquerading as chronic illness. How doctors often miss the link. Here's the part that frustrates people the most. You go to the doctor with symptoms like pain, fatigue, and brain fog. You get blood work. Maybe they test your thyroid, your vitamin D, or your blood sugar. But unless you specifically ask for a hepatitis C test, it often isn't done. Why? Because there's a bias. Most healthcare systems assume Hep C only happens to people who use IV drugs, people who've had risky sexual behavior, people over a certain age. But the truth? Anyone can get it. From a tattoo, dental work, surgery in the 80s or 90s, a transfusion before modern screening, or even sharing a razor. Even nurses, students, and parents who've never done anything risky are testing positive decades later. So yeah, sometimes the diagnostic blind spots are the problem. Real stories, the people behind the symptoms. Let's humanize this for a second. Meet Karen, a 37-year-old mom from North Carolina. She spent years battling fatigue and joint pain. She was misdiagnosed with fibromyalgia. When her symptoms worsened, she demanded more tests. Turns out she had chronic hepatitis C, likely from a childhood surgery. Then, the emotional and social toll. Let's get real for a sec. Living with chronic illness, especially one that isn't fully understood, or worse, stigmatized like Hep C, can be emotionally brutal. You feel crazy, you feel lazy, friends don't get it, family doesn't understand understand why you cancel plans or sleep 12 hours a day. You start wondering, is it all in my head? It's not. Chronic illness and undiagnosed Hep C can chip away at your identity. They can affect your relationships, your job, even your mental health. It's like fighting an invisible battle every single day. And while that's heartbreaking, it's also where the power of knowledge and community comes in. When we connect the dots, we start healing. Healing approaches. From Western medicine to holistic remedies, let's talk about solutions. Because while this stuff is heavy, it's not hopeless. Medical treatments. There are modern antiviral treatments that can cure Hep C in 8 to 12 weeks. If caught early, the damage can be reversed and chronic symptoms improved. Ask your doctor for Hep C antibody test, confirmatory RNA test if needed, liver function panels, holistic support for chronic symptoms. If you're battling fatigue, brain fog, or inflammation, try anti-inflammatory diets. Think leafy greens, turmeric, fatty fish, gentle exercise like walking or yoga, adaptogenic herbs like ashwagandha or rhodiola mental health therapy, because this journey is emotional too. Sleep hygiene, no screens 1 hour before bed. Yes, even TikTok. And most importantly, community. You're not alone in this. Preventing long-term complications. If left untreated, Hep C can lead to liver cirrhosis, liver cancer, diabetes, autoimmune diseases, neurological complications. But with early testing, lifestyle changes, and medical treatment, these outcomes can be prevented. You don't need to wait until things get worse to take action. Knowledge equals power, and you've got it now. Final take, what you need to ask your doctor today. Before we wrap, here's your checklist. At your next appointment, ask, can I get tested for hepatitis C? Could my symptoms be related to a chronic viral infection? Can we explore viral causes before labeling this as just anxiety or fatigue? What options do I have for managing these symptoms holistically? Because you deserve answers. You deserve validation, and you deserve wellness. Real, sustainable, joyful wellness. Let's talk. So now we want to hear from you. Have you dealt with chronic illness symptoms that no one could explain? Have you ever been tested for hepatitis C? Do you think there's a bigger link between chronic illness and hidden infections? Drop your story in the comments. Let's open this conversation wide. And if you found this video helpful or eye-opening, give it a like, subscribe, and hit the bell. We've got so much more coming your way, because at Octavious Wellness Center, we believe healing starts with truth and sometimes a little laughter. See you in the next one.